Today we have Annie with us. She is a 34-year-old female who has never had any cosmetic procedures done before. We are going to be carrying out a full face dermal filler treatment. So Annie, we've had a brief conversation about some of the concerns. Just to summarize, your two main concerns are under eyes, side profile, primarily the chin area. Is that right? So I'll talk a little bit about these areas, but then we'll talk about any other areas that we can potentially treat just to improve the overall look.
Yeah.
So the under eye area, what I can see, there's a hollow in the area. There's good skin quality. There's a little bit of pigmentation. But if there's a hollow and there's pigmentation, you almost always get the best result with tear trough filler first. By improving the hollow, it gives you a smoother transition from the under eye to the cheek. Now, you said you're 34 and there are some predictable changes that happen once we start dipping into our 30s. The primary thing that we see is volume loss and change of volume in certain areas. So I'll just talk a little bit about some of those changes and relate them to you. So working from top to bottom, there's a little bit of volume loss in the temples. The reason why that's an important area to treat is because we want a smoother transition from the forehead to the cheek. It's not bad, but there's a little bit of a hollow in the area. There's some volume loss in the under eye area and volume loss in the apples of the cheek. Your cheekbones are actually really nice. You've got sharp cheekbones, and to be quite frank, they're going to stay with you for the rest of your life. But the area that does tend to lose a little bit of volume is the apples of the cheek. As we get older, this area starts to sink down. So then we get deepening of the nasolabial fold. This area here, unfortunately, is called the jowl. As we get older, it starts to sink down and it interrupts the jawline. Ideal jawline is a smooth transition from the angle to the tip of the chin. Looking at the side profile, I don't think you've got a bad side profile, but if I was to improve it, I would project the chin from the side. That will balance the side profile, lifting the tip of the nose and softening any little bumps that I can see in the bridge of the nose. You talked a little bit about your lips. I think you've got a very pretty pair of lips. The goal is to hydrate, improve the volume slightly, but make sure that they're within the realm of natural. So that's what I would do as a treatment plan. Is there anything that you disagree with there?
No, I completely trust you. And
Okay, cool. Amazing. Regarding the procedure itself, all we're going to be using today is dermal filler. Dermal filler is a gel. The gel's made of hyaluronic acid. We naturally have hyaluronic acid in our body, so it's not seen as a foreign substance. It's been stabilized, so it has a gel-like quality and it has longevity. When we inject it, you see results almost immediately. There will be a little bit of redness and swelling today. Sometimes you get a little bruise in the areas. But today it will still look nice, but it will look its best at 2 weeks. At the 2-week mark, that's the finished result, and that result will last anywhere between 1 to 2 years.
Okay.
Any questions, any concerns?
No, none. Looking forward to it.